Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida in Fort Myers, Florida. A common condition that we see is pelvic floor dysfunction, which can cause pudendal neuralgia or compression of the pudendal nerve. The most common treatment for pelvic floor dysfunction is actually different types of physical therapy. And often that is helpful, but very seldom do I find that it cures people. If somebody has really severe pudendal nerve pain, sometimes they actually even have surgical decompression. So the surgeon is trying to release the nerve surgically in the various parts of its path that can cause compression. What most people don't realize is that the pudendal nerve, the reason that the pudendal nerve gets stretched, gets compressed, gets irritated, is because of pelvic instability. So I just want to explain how pelvic instability causes pudendal neuralgia and also pelvic floor dysfunction. So this is basically the pelvic floor. The pelvic floor is in between the pubic symphysis and the sacroiliac joints here. It's right here, the perineum. If you see here, this is actually the sciatic nerve. This is actually the sciatic nerve. So we all know the sciatic nerve goes in the back of the leg down to the foot. But most people don't realize that these nerves, as you look in here, this is from the L5, S1, S2, S3 nerves. These nerves come out the sacrum. So the sacral nerves, the S1, the S2, the S3, they're actually housed within the sacrum. So I just want to show that. Okay, so you see, like, this is the sacrum. So this is the sacrum. See how the sacral nerves here, they're actually housed within the sacrum. So the most common reason the sacral nerves would get irritated is because the sacrum's moving too much. So some of these nerves come out the back, but then some of the nerves, they're going to come out the front, and then they're going to go into the perineum. One of those nerves is the pudendal nerve. You know, the nerves are coming out the front here. So some of these, the lower sacral nerves, they're going to form the pudendal nerve. That's what you see here. See how it's going out of the sacrum and then it forms the pudendal nerve. So the question is, what would cause the sacrum to rotate, the sublux, to have too much movement where it actually is going to irritate these sacral nerves? Well, the most common reason is going to be either sacroiliac ligament laxity or pubic symphysis laxity. Now, sacroiliac laxity, in other words, the sacrum and the iliac crest, they move too much. So say a person had right pudendal neuralgia, and what that would cause is unbelievable pain in the perineum, and it often can be on one side, so terrible pain in the perineum. Well, the pudendal nerve, it goes between the sacrotuberous ligament and the sacrospinous ligament. Right here, the pudendal nerve, to get into the pelvic inlet here, it goes between these two ligaments. So if somebody has laxity on one side, ligament laxity on one side, that would mean that there's going to be extra bony movement of this innominate bone on that side, and the pudendal nerve can get entrapped between the sacrotuberous and the sacrospinous ligament. So the treatment then would be proper alignment of the innominate bone and also stabilization of the pelvic instability with prolotherapy.